All right, let's begin this second hour of the program talking about nursing and nurses in this province. Now, last month, the FIC, one of the big unions in the province, reached a proposed agreement with the Quebec government after 16 months of negotiations, right? So after they reach that agreement, this goes to a vote with the membership of the union. And that voting is wrapping up in the next few days. Now, one nurse is worried about this tentative deal that could now be accepted. We head to Jennie Rhee, head of the MUHC Nurses Union, who's on the line. Jennie, welcome to the program.
Good morning, Mr. Makos. I hope you're well this morning.
I'm doing very well. Now, here's the thing, right? 16 months of negotiations seems like it was hard fought. Seems like nobody got what they wanted, which I hear is a good way of telling if it was a worthwhile negotiation. Why are you ringing the alarm bells this morning about this deal and the vote that's happening right now and how it could be adopted?
So when the delegates were in St. Hyacinthe last month and we were presented the tentative agreement, of course we argued over solid 2 days. And of course this is a democratic process. We, MUHC, we made the difficult decision to put in our dissidence. And what a dissidence means is that we cannot rally or recommend to our members the acceptance of this tentative agreement. It's been a rough 16 months. You're right. We were out on the picket lines in the dead of winter, and we find it severely inadequate. But the biggest, I think, thing that we are very concerned and upset about is the opening on mobility. And mobility was something that has always been a non-negotiable for us, locally and across the province.
And one thing here, Jennie, and I get it, right? If you're not in favor of a proposed deal, you got to try and make your point. But one of the things I think this is from you, I've heard this called that the deal would destroy nursing. That's a weighty sentiment here, right? And does it have to do with that mobility portion of the deal?
It has a huge part to do with mobility, yes, sir, because what the government and the tentative agreement highlights, and this is very new, and in my 36 years as a nurse, I've never seen this before. It is a very dangerous proposition. And we see it like this because maybe the public needs a clearer picture. The government, should this pass, would have the right within the island of metropolitan Montreal to, with 30 days notice, to move a healthcare professional, and I represent also nurses and respiratory therapists and perfusionists at the MUHC, but they would have the right within 30 days to move these people within 25 kilometers of their home base. So the home base being MUHC. And we've never seen that before. And outside of the metropolitan Montreal area, the government would have the right to move you 35 kilometers. And that, when it passed by a very slim margin at our federation, 53%. 47% of us thought that was opening a can of worms, and we could never recover from that. Following that, I received numerous calls from people who are preparing to take their NCLEX. NCLEX, for those of you who don't know, are the licensing exams in the United States, and many of them are preparing their CVs to go and apply outside of Quebec. So we're already short nurses. We're very short-staffed. Even at the MUHC, we provide very acute tertiary quaternary care to the sickest of the population. We can't afford to lose any more.
So, Jennie, I could hear the arguments already from the government, and they would probably say, we opened up the wallets, we opened up the Quebec public purse, and we gave a decent salary increase, more than we were originally prepared to give. And what we asked for in return was flexibility. This is part of that. It's a fair deal. What do you say to that?
We do not consider it a fair deal. When you lowball people, okay, you start very low. In the context of the economic situation currently, and with the rates of inflation that we are seeing, the interest rates, etc., it was never a good deal to begin with. But when you come up to 17.4, and you take into consideration that we lost healthcare professionals 3.5, that was in our last collective agreement, it becomes 13.9 divided by 5, less than 3%. It was never a good deal to begin with. And what the public should know is that with this proposal of moving people around, and I get it, it's a business model that perhaps might work in a business, but we are human beings taking care of human beings, and there's so many things to consider. We are 92% women. We have young families. We have elderly parents. We made life decisions based upon where we chose to work. Maybe we bought a house. Maybe we're close to a metro. And we can't afford to be told with 30 days notice that we have to go somewhere else. But going back to the economic situation that you mentioned, sir, I would like to highlight when you have to train a nurse, okay, and you move them around, it's usually 4 to 6 weeks on an average, the kind of training that is required. That means you need a preceptor. So you're paying 2 people to kind of train the other one to eventually do the job. That in itself has tremendous cost. And even at the MUHC, we've seen centers where they were merged and they were never able to train. Why? Because those people, there was never enough people to train, or for one reason, or the budgets were restrained. So then eventually they wound up, going back and saying, okay, we can't. And that's what we're seeing. And now we're in a context where we have such low staffing that I don't envision how they're going to do this easily.
So, Jennie, have there been any assurances on the levels or rates that the government would try such a thing? Because in my mind, it's one thing if they say, okay, 25% of MUHC nurses, you've got to go north of Laval. I'd be like, oh boy. Is there any goodwill from the government saying they're only going to use this power in extreme circumstances?
We have nothing in writing. So the details have not been ironed out. I think, they're trying to pass this mobility because of what's coming with Santé Quebec and with Bill 15. They need mobility in order for the bill to be to work, if I could put it that way.
Yeah.
And they always said we need the unions to open on mobility. We have always said, I said it to you guys in December when we were on the picket lines, one thing that is non-negotiable for us is that. But, I was asked a question yesterday and they said, well, but don't you want to go help? If there are areas that need nurses and patients are suffering, don't you want to go? And my answer to that would be yes. We do, but do it on a voluntary basis. The government has put a clause that if I choose to go voluntarily, that they would compensate you depending on the kilometers, certain things like $50 a day for an 8-hour shift or $100 a day if you're outside those kilometer range. We did it during the pandemic. I want to be very clear. Even when we were very short-staffed during the pandemic and we were like exhausted, Dr. Feller put a call out to us and said, hey, anybody who wants to go to an outlying region, I encourage you, in the spirit of healthcare and helping our fellow citizens. And we went as teams. There were managers even who went and worked in CHSLDs to help out. It was a dire situation, but we did it voluntarily. We were not forced to do it.
Jennie,
and that's the big difference.
Jennie, let me tell you something. You're a dynamo, by the way. You come back anytime. If you got the passion like this, you're so well-spoken on these issues, and we always want to cover the healthcare system. So come back eventually. Let's talk about other things, and we'll see how this plays out. Thanks for your time.
Thank you for your time. Thank you.
Jennie Rhee right there, head of the MUHC Nurses Union.